This past Friday was Crazy Socks for Docs Day. It's an awareness campaign first started by an Australian doctor aiming to erase the stigma around mental health in the healthcare environment. Now, the initiative gained even more traction during the COVID-19 pandemic when our healthcare workers became our frontline soldiers. So now, with the pandemic having passed, some would say maybe not just yet, are our carers taking better care of themselves? Let's talk some more about it with our resident GP, Dr. Donny Fick. He's quite literally just stepped off a flight from Singapore after a week in Japan on holiday. I'm telling the country your business, Dr. Donny. But thank you so much for coming in. Let's hope the jet lag isn't too bad. Before we talk about Crazy Socks for Docs, talk to me about traveling in this post-pandemic world, especially traveling in Asia, where you and I both know wearing masks and that kind of thing has always been part and parcel of life in Asia. What's it like over there? What was it like traveling there, and what did you observe while you were there?
Masks are definitely part of the culture. I was in Europe earlier on this year, no one wore masks. Arrived in Japan, and I'd say at least 60% of the people there were masked. There was still a health questionnaire, I don't know if you can remember those from COVID.
Yes.
Had to fill one of those out. And I traveled with one of my doctor friends who's a pulmonologist in Australia. And every time I didn't have a mask, she would silently slip me one and be like, Donny, even though we've moved on from COVID, it's not over yet, and people still get sick, and the mortality is still there, so just be careful.
And of course, traveling in a place like Japan, is the sheer number of people who are moving all the time on those very busy train stations as well, and it's just part and parcel of everyday life there, isn't it?
But I remember being there previously, and I didn't see as many masks as I saw now, and I think they're still definitely living in sort of still cognizant of COVID. I was sitting in a food court where you each had like a plastic booth with like shields around you, so one person at a time would still sit and eat. So those things are still definitely there. That
will help us always remember. Now let's talk about Crazy Socks for Docs. You were in Japan, but you did post on your social media your pic with your crazy socks, which we all know you have many pairs. But on Friday, it really meant something else, didn't it? And I remember chatting to you during the COVID pandemic, during really hard lockdown. Yeah. And our doctors and our nurses, all our healthcare workers, I think were really taken to the edge of their mental health strength 100%. Because they were faced by so much. Do you think that the population of human beings who make up the healthcare force in South Africa has really dealt with the impact of COVID-19?
I'm going to put my head on a block now and say no, 100% not. I think earlier on this year at Moore Park Hospital, where I used to work, two doctors that I had worked with there committed suicide. So that's two doctors in one hospital in the first 3 months of the year. And I think it's a profession where you always get taught that you need to soldier on, patients come first. And I get that to a certain extent, because that's what makes you a good doctor, but it makes you a really bad human, because you never take care of yourself, you never take care of your family. I think we've got in a profession one of the highest divorce rates, substance abuse rates, suicide rates. And at some stage, we're going to need to look a little bit deeper. And I'm glad we're doing this initiative now where we say, stop, we need to look after ourselves, because you can't be a good doctor and a good carer if you don't care for yourself. If your cup's not full, you can't look after someone else.
We live in a world of hashtags, and the hashtag "It's okay not to be okay" is out there. Is there an understanding in the healthcare profession that it is okay to not be okay? And do you talk about
I'm still going to say no. I'm still going to say no. Yes, there's a few of us that are active on social media, and I feel like this is where there's a bit of a disconnect. Yes, we'll post about it on social media. Yes, we'll wear our crazy socks one day of the year, but we never check in with our colleagues. It's a very lonely profession, because you never work with other doctors. It's usually you're on your own, you're in your consulting room, you never have colleagues around you that you bounce ideas from off as well, and you never get a chance to sit down and catch up. There's no tea room where you're like, are you okay? How are you doing? It's kind of like you move from one death or one resus to the next thing, and you just keep sweeping them on and sweeping them under the carpet and moving on.
And I know your colleagues, like in psychiatry and psychologists and therapists, know that they are supposed to have therapists that they speak to, so that they can debrief after a week of really giving of themselves to other people. Do you think there's a need for that in sort of the world of GPs, surgery, and sort of general medicine?
I think it should be put into like in a hospital setting. I think GPs are a little bit more protected from this. Yes, we do give a lot to ourselves. But I think if you work in a hospital, and if I look back at the time that we worked in a hospital during the COVID years, I think no one's unpacked that. And I think the system has let us down to a certain extent where the bigger companies should have put structures in place to be like, yes, we understand our doctors are working hard. Let's provide them with therapists or spaces where they can talk about these things. But if you take a day off, it's like, why are you not at work? Patients need to be seen. There's so much pressure, and that pressure never gets unpacked.
Is it difficult to understand what needs to be unpacked? Is it dealing with the possibility of somebody dying within your care? Is it dealing with the pressure of being good enough amongst your peers? What are some of the things that you think you're dealing with from a mental point of view?
I can only speak from a personal point
Please
of view.
do, if you don't mind.
Yeah, and I think for me, I think during COVID, I thought I was going to die from COVID. I remember somewhere in 2020, I went and bought a sports car. I was like, and people asked me why, and I was like, I think I've got 6 more months. This was pre-vaccine. And I was like, if I don't live my life now, I don't know how much longer, because death was so relevant. And lots of our colleagues would be passing away from COVID. And you're like, it might be me next, might as well live my life. So I think back in the COVID years, it was the fear of getting it and dying. And I think now it's about the stigma, and I still have to speak about it. The stigma of saying, in a place where you get taught to be the hero, you get taught to sweep things under the carpet and just move on, to say, guys, I'm actually not okay. I'm not okay. I've dealt with death, dying. We've done a big trauma burn surgery, and it's taken a lot out of me, but it's just expected to move on.
What impact does the hierarchy within the health profession have? I mean, you've got your doctors, and I know within the world of the health sector, you've got different characters. There's a certain type of person who becomes a surgeon. There's a certain type of person who, is an orthopedic surgeon or cardiologist and that kind of thing. So you've got the hierarchy, but then you've got your other healthcare workers. You've got your nurses who are the heart and soul. You've got the people who clean.
They all take the brunt of it, right?
Well, that's what I wanted to know. What impact does that hierarchy have in terms of people having the confidence to say, look, I know I'm just the nurse who comes in to do the rounds in the morning, but I'm also not okay.
Yeah, and that should never be undervalued at all. But I think we need to speak about this more. And be like, yes, it's not just the doctors. It's the nurses that are helping. It's the physios. It's the clerk whose job is purely admin, but she has to see all the trauma as well. It's the whole system that needs to take care of themselves, take better care of themselves, and take notice that this is a highly stressful place to be in. And one group of people that get totally ignored or not seen in this is the families and the spouses of those people. And I'll talk from personal experience. My wife sat me down in December last year, and she's like, if you do not talk about this to someone, I am actually going to leave you. So I was like, why would you ever want to leave me? I'm amazing, right?
But I talk about death every night when I come home
and
from
doctors
work.
do have an air of arrogance about them. I'm like, why would you ever want to leave me? I mean, I'm amazing. And she was like, you have changed over the last 2 years. You've become grumpy, angry, short, snappy, and just really not nice to be around. So if you don't fix this,
and yet your patients,
I'm out.
And I think the thing is there that your patients don't see that, because you're Dr. Donny, you're on point, you're there to help them and listen to all of their stories.
And then you come home and you have absolutely nothing to give. And I don't have children, but I'm sure if you've got a 2-year-old and a 4-year-old and you've just spent all your energy, you're not going to want to, you don't have the capacity to do that. And I think it's time. I think it's long overdue that we sit down, we hit the pause button, and we, guys...
Have you made a point, seeing as you've had that a little bit more of a self-realization, have you made the point of checking in with your colleagues?
Yes, I have. Okay. So I try and do it like every Monday, like just phone one of them and be like, let's get coffee, let's just talk about it, what bothers you, because that's where it starts, right? Like you just have to reach out and break down those barriers of communication and touch base with them and take breaks. I mean, we feel like we can work forever, like just keep working. Do you want to take a break? It's a really busy season, it's flu season, we can't, the practice is busy, the hospital's busy. It's so important. And you'll know personally when you reach that point where you can't give anymore, that you should actually tap out.
If you don't listen, your body makes you listen, don't they? Dr. Donny, it's always insightful chatting. And I suppose a lesson to all of us, my colleagues in my ear saying, in newsrooms also we need to check in with each other.
100%.
Under different types of pressure, but pressure nonetheless.
And I suppose I can only speak from a medical point of view, but I think every job has its stresses. And you're right, that's a very good point, that everywhere we should just, we live in such a self-centered, selfish world where you should just stop and be like, I'm not okay, but how's my colleague doing? How's my friend doing? I think that's the most important take-home message. Dr.
Donny Fick, it's always great having you on. We'll talk again soon. Go and recover from Japan, the privilege of it all, and we'll chat again soon. Thank you for your time, and thank you for your honesty and your openness in talking about a really, really important topic.